All right, in this video, I want to talk about what makes the MovementRX Remote Therapeutic Monitoring System unique and better than everyone else's, right? My name is Dr. Andrew Gorecki. I'm the owner of Superior Physical Therapy, a private practice in Michigan, as well as MovementRX, the Remote Therapeutic Monitoring System. So, there's a lot of remote therapeutic monitoring systems out there. What sets this apart from others? Well, I can tell you the big thing is and this goes back for me about 7 years ago. I created MovementRX initially as a home exercise app. And the reason I did that was because we were using, initially, when I started my career about 12 years ago, we were using VHI printed documents that were like a library of exercises you'd print and give to the patient. And I always had a hard time searching in the library. I could never find the exact thing I wanted. So what I was giving the patient was kind of close to what we were doing, but not really. Um, and so about 7 or 8 years ago, I started taking videos of people using their own phones. And that was great. The problem is they'd come in, a week or two later after doing that first video, and they were having a hard time finding the video on their phone because it was like in the library of all their photos and other videos. It wasn't organized. So I said, gosh, wouldn't it be cool if we just had like an app that just stored their videos, and then we could see their participation level and we could give them encouragement. And so we created that on our own before remote therapeutic monitoring even was a thing in beginning in 2022. So our platform has no libraries. It is 100% custom exercises that you're making with the patient. You're involving the patient in their plan of care. And it only takes 30 seconds. It's on an iPad or a phone. Click the button, take a video, and it's done. You don't have to go search through a library of something that may or may not be like what you're using, right? So that's number one X factor, is it's all custom. Now, there is an option where you can use your own library. You can upload from a library you've created. I wouldn't recommend it, though. If you read the reviews at Superior Physical Therapy, we have over 500 five-star reviews, and now Google gives you a little keyword on the top that says what people say the most in your reviews. The number one keyword is videos, and you read those, they talk about how much they love the custom videos. They felt like the service that was given to them was one-on-one and individualized just for their needs. So no libraries, only custom. However, if you want to make your own library, great for you. You can do it that way. Now, the other thing is we have the company MovementRX has two options. We 100% will do this for you with the 50-50 split. You keep 50% as your profit because there's no other expenses. We take 50% and then we pay our remote providers to do all this remote providing, remote monitoring for you. You do nothing except take the app and get your patients on it and take their exercises, right? So we have that option. We also have a do-it-yourself option. The do-it-yourself option is we just give you the technology. You figure out all your workflows. We've got training videos on how we recommend things being done, but you have to hire your own staff and do your own thing. That's $15 per patient per month, right? So those are the X factors. It's all customized, and by the way, it has 7 years of testing, right? So there's a lot of these companies that are 6 to 12 months old. We have 7 years of testing with 14 physical therapists and 7,000 patients. So it's been proven, and we've modified that over the years to really fit the needs of the patient and the provider. So hopefully that helps you understand the X factor with MovementRX.